Low Health Literacy, a health education program for the NURS 444 Community Health Nursing course. By Katie Grogan, LPN to BSN student nurse at Indiana State University. Learning objectives. Identify the population at risk. Define the term health literacy. Determine health literacy in a cultural context. List the skills needed for health literacy. Describe the economic impact on low health literacy. List the research findings on low literacy health outcomes. And successfully take the pre- and post-exam. The population at risk. Low health literacy is linked to higher risk of death and more emergency room visits. Low health literacy uses more healthcare services and are at greater risk for hospitalization. These individuals have a higher utilization of expensive services such as urgent care and inpatient admissions. The most vulnerable at-risk populations are older adults, minorities, immigrants, and those with low income. Health literacy defined: the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. So for us, as healthcare professionals, terms like hypertension, bradycardic, anemia, they all become second nature to us. But for other individuals who do not understand information within the healthcare system, this can lead to problems and concerns that put this population at risk. In a cultural context, we have to understand that health literacy is affected by belief systems, communication styles, understanding, and response to health information. We are moving towards patient-centered healthcare. These are efforts put in place to improve the quality of healthcare. Patients and providers need to work together to ensure effective communication. If patients are not understanding what is being spoken to them, it can lead to insufficient treatment, non-compliance, confusion with medications, again, ER visits when possibly they're not needed, inpatient hospitalizations. These are just a few of the concerns if someone is not able to understand what is being explained to them. And the cultural piece of it is a huge part that healthcare providers need to be aware of, because they may believe in things differently, may communicate, again, the way they're comprehending things and their response to healthcare. All of those really affect an individual and their ability to understand. So the skills needed: one must be visually literate. They must be able to understand graphics and visual info. Computer literate. With the way technology is in, most information is given via internet sources. Information literate. They must be able to obtain and apply relevant info. Numerically or computer intentionally literate, so able to calculate and reason numerically. They need to be able to ask pertinent questions. Again, it goes back to that comprehending and understanding the information that is being provided to them. So having a need to understand spoken medical advice or treatment is vital to the healthcare field and to patients that are receiving the information. They need to have strong decision-making skills. So when information is presented to them as far as medication or treatment options, these patients need a strong skill in the decision-making aspect to be able to decide on their care and how they want to be part of their decisions. Oral language skills. There needs to be able to articulate their healthcare concerns and describe their symptoms. How does it impact the economy? Low health literacy is a major source of economic insufficiency in the U.S. Improving communication reduces healthcare costs and increases the quality of healthcare. So again, that patient-centered care, the patient being able to tell us their needs and symptoms, and the healthcare industry being able to accept that and proceed with full understanding that the patient is comprehending what is being provided to them. Low health literacy costs the economy approximately $106 billion to $238 billion annually. So this is a significant amount of financial means affecting the economy when we have individuals that have a low health literacy. That's approximately 7 to 17% of all healthcare expenditures. This cost represents the amount equal to the cost of insuring every 1 out of 47 million people who have lacked coverage. So research has found that these individuals are less likely to get a flu shot. They have a greater likelihood of taking their medications incorrectly. There's higher mortality rates. They're more likely to be hospitalized and have bad disease outcomes because treatment options are not fully understood. They're not understanding the way their medication should be taken or how often. There's not frequent follow-up care. There's poor health status, and they're less likely to use preventative care. The Joint Commission stresses the importance of health literacy, communication, and cultural competencies. It is an element of quality healthcare. Public health and community health nurses must promote the importance of low literacy populations and ensure they understand their condition, medications, treatments, and care needed. We will now review the questions and answers to the post-exam. Question 1. Which of the following are linked to low health literacy? A, B, and C. Higher risk of death, more emergency room visits, and hospitalizations. Question 2. Which vulnerable population have a low health literacy? All of the above. Question 3. Health literacy is defined as the degree to which individuals have the capacity to A. Obtain, process, and understand health info. Question 4. To continue with that definition, B. So together, the entire definition of health literacy is defined as the degree to which individuals have the capacity to obtain, process, and understand health information to meet the basic health information and services needed to make appropriate health decisions. Question 5. Which of the following is an effort to improve the quality of healthcare? D. Patient-centered healthcare. Question 6. Which of the following health literacies are affected by? All of the above. Belief systems, communications, understanding, and response to health. All of those affect the ability of someone's health literacy. Question 7. Why are oral language skills important in healthcare? And C. An individual must need to articulate health concerns and describe their symptoms. Question 8. Why are patients more likely to have disease outcomes? A. Treatment options may not be fully understood. Question 9. Which of the following literates affect an individual's ability to comprehend health info? All of the above. Visual, computer, information, and numerical. Question 10. Which organization stresses the importance of health literacy, communication, and cultural competencies? D. The Joint Commission. All of the information is referenced and cited from the Network of National Library of Medicine, nnlm.gov.